you are a cardiologist and you do surgeries. In your opinion, you must have you must have operated on people who are smokers. You must have seen the difference in what their bodies, damage being done to their bodies by the two. Can you draw a comparison for us between that?
So ultimately, why do you get problems in the first place is because something which is not natural to your body has entered your body and your body is trying to fight it off. That's fact. Okay. Whether it's a bacteria or whether it's a chemical, your body is designed to not accept anything that is natural to it. And your immune system is geared towards throwing that bugger out. You wouldn't want some next door person coming into your house and staying there. You'd want to throw him out. So that's the same way your body is designed. When you look at smoking, as per se, if you look at the main ingredient in smoking, we call it the main ingredient is nicotine. As per se, nicotine is considered to be a stimulant. Okay, it's just like caffeine. It works by stimulating certain receptors. So it doesn't cause as much harm as people think it should. But what happens is when you smoke and you're having combustion, or what we call as generation of hydrocarbons or generation of multiple different chemicals, and we all know as many of us here must be ex-smokers and some of us might be still smokers, and you've been fed this information that smoke contains more than 4,000 to 5,000 chemicals in them. These chemicals, when you inhale them, they go into your lungs, they get absorbed into your bloodstream. So the first point of contact is your lung. The second point of contact is your bloodstream. So what happens is all the blood has to go to the heart. All blood. Okay, that's the main pumping station. So invariably, all this blood lands up in the heart, starts causing a damage to the heart vessels, and these patients usually end up over a long period of time with injury to the walls of the vessels on the internal aspect. That's why these people start developing, cholesterol plaques and stuff and all that. So that's why you go to any cardiologist who's worth his salt. If you tell him you're smoking, first advice is stop smoking, right?
Right.
But you and I, all of us know how hard it is, right? It's very, very, very difficult because when you smoke or when you vape or when you're used to a certain chemical or whatever you call it, there is an association that happens in your brain. And your brain starts linking your good feelings and everything along with the thing. So it's very, very, very hard. And that's the reason why these industries are doing well for thousands and thousands of years. So yes, if you look at it from that point of view, the difference between vapers and smokers. So it's too early to get data with regards to cardiac disease with vapers, but evidence has shown that the accumulation of cholesterol plaques, the injury to the arteries and the veins, which happen in vapors, it's much, 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 much less compared to what it would happen in a smoker. That is something what they have found. It's too early to get data because smoking has got 3,000, 4,000 years of history. So they've got all the data in the world, right?
Yep.
So people have just started vaping since 2005. So we need some time, but whatever evidence we have got so far goes clearly in favor that vaping is a much more safer alternative compared to smoking.